today we are going to talk about pee, and that is why I'm wearing a yellow shirt, is because we all want to talk about pee. So there you are. You should have that now. And let me go up here. There we are. There we are now. So we have to first of all understand the anatomy of the critters that we're looking at. And the first thing, let's look at the different female and male anatomy. And in female, dogs and cats are quite similar. So that is this is a dog, but females of the female felines are real similar. And there's some things in the anatomy that are significant for when we're looking at urine and when we're discussing cystitis. So that's why we're looking at this. It isn't just because I like to show pictures. So when we can see here, here's with a female, the urinary tract and the reproductive tract are quite close together. Here's the kidney. Those are the ureters that come down from the kidney. There, they disappeared. And they enter into the bladder. Now you can see that the female's reproductive tract sits here above the bladder and urethra. And when this urethra comes out of the bladder, and then it dumps into the very end of the vagina, which that is significant because that is not the same as in people, for instance. You have, this is an area where you can have contamination of the urine with products from the reproductive tract if the female has a reproductive tract. So that's significant. This is the vulval papilla, or it's a little bumple upon which the urethra opens. So that's what the female looks like. You can see that this vagina here is rather short. You'll see how in comparison, and it's rather big. So you have this big opening here that leads to this urethra from the bladder. Again, this is going to be significant. We'll talk about that. So now here's the male dog. The male dog and the male cat are different. Now, males do things a little differently from females. You see here that the male reproductive tract, the testicles are down here instead of up here by the kidneys where the ovaries were. And that's because they start up here, but in mammals, the testicles take a little trip down to the scrotum because they want to be cooler to make sperm. So that's why they move there. It isn't, just a whim. There's a reason for it. So in a male dog, you have your urethra here, and now where it empties from the bladder, you have the bladder, and then the urethra empties from, I don't know why my cursor keeps going away, but we can all deal with this. So from the bladder, here's the urethra, and this is the prostate gland. So if a dog has problems with its prostate gland, cells from that could get into the urine as well. Another thing with the male dog that's significant is that the urethra comes on down here through the penis. It takes a nice gentle curve here down the penis. And here in a male dog, you can see this little white bit above this end of the penis. That's an os penis. Male dogs have a bone in their penis, and that can be significant as well. And male dogs also have a prepuce, which is of a significant size and can get debris in it as well. So that's the male dog. Now let's take a look at the male cat, who I flipped him just to make this a little more interesting. You can see again, the testes have also migrated back. In a cat, though, they sit way back, they don't hang down on the abdomen. They sit back here above the penis. And you also see in the male cat, there's a little bit difference here. Here is the bladder, and here again, you have your ureters coming in. Now the male cat urethra has a couple sharp turns in it, which is significant if you're trying to catheterize them. The male dog urethra is rather smooth. The male cat urethra hangs practically a right turn back here around the bulbourethral gland, and then it hangs another right turn right here, right when it comes out of the pelvis. So this can make cats a lot harder to catheterize, which is why when a vet tells you, boy, it took forever to catheterize your cat, they're not lying to you. It can take forever to catheterize a cat, especially if it's gotten swollen up because they have a urinary tract inflammation. So now we have all this information, and you know all about this anatomy, and you'll remember all of it. So that's on to the next slide. So let's talk about cystitis. So sometimes when people talk about cystitis, they think of a urinary tract infection, and that isn't really the case. So cyst is a word that means bladder, and itis is a word that means inflammation, not infection. And so when you have inflammation, you get the signs of rubor or redness, calor or heat, tumor, swelling, dolor, pain. So this is inflammation signs. This is not infection signs. Now, there are true infections, of course, that happen in the urinary tract. And if they ascend into the kidneys or they make the animal feel systemically ill, those definitely need assistance from a vet. If you have signs of cystitis without signs of systemic illness, it is something that can be treated symptomatically. But if it does progress or if the animal's ill, then you need to get help. So let's see, what is a urinary tract infection? So you have to have signs of cystitis, which are things like frequent urination, painful urination, urgency, meaning I gotta go, or having accidents in the house, which would be a result of having to go, blood in the urine, which we also call hematuria, and that can usually looks red, but it can also look like brownish flecks, and straining at some point during urination, maybe before, during, or it could even be after, because if the urine is painful, some animals will sit there and just keep needing to go. Other animals will not have trouble getting it started because the tract is inflamed. And so you don't just have signs of cystitis, but to have a urinary tract infection, you have to have infectious agents, which in the case of dogs and cats is usually bacteria. These things do apply to other animals like large animals and such, but in general, we're going to be talking about dogs and cats. There are a lot of problems that can look like a urinary tract infection. There's things like kidney disease, because with kidney disease, the animal's making a lot more urine because dilute urine is easier to make than concentrated urine, so they make more dilute urine. Diabetes looks like kidney disease because they have sugar in their urine, so they have to have more urine come out again, and they will have accidents for both of these because they have so much urine coming out. And then there's incontinence, which is either geriatric weakness or post-neutering weakness, usually in females, the hormonal weakness. So those are ones that look the same. And then there's predisposing problems that can bring on urinary tract infections, such as bladder stones or crystals in the urine. The stones form when crystals coagulate into a stone in the bladder. Diabetes is a predisposition as well, because when you have all that sugar in the bladder, the bacteria are happy to party down and eat it. Why not? Cushing's disease or hyperadrenocorticism is more likely to lead to urinary tract infections because those dogs have high steroid levels, and steroids decrease the body's resistance to infection, and so they're more likely to get these. Hypothyroidism, because they have a low metabolic rate, they're more likely to get infections. So these are things, this is why if an animal has a sign of systemic disease, or if they have recurrent urinary tract infections, you really need to get to the bottom of it deeply, or if they're, because there are all these other things that are going on. You want to treat with the animals for the problems they actually have. You don't want to guess what they have, because a lot of these things look similar. So that's why whenever they seem to have a problem, you want to treat based on the facts. So I do suggest that when there's a urinary tract infection, that you get urine and you have it analyzed by your vet, and have your animal examined. You know, it's a good thing if there's a urinary tract infection or urinary tract inflammation that's going on. So urine is often underrated. Urine is not considered as important lab test as blood. And it is so full of information for us that we don't want to neglect it. So you want to collect it in a way that it's going to give us the most information. First of all, if you can, obviously, some dogs are, if you go at them and try to clean their perineum, which is the bit around the vulva in a female, or their penis, some of the animals will not take to this real well. You're not going to get real far. But if you can clean it real gently with a unscented baby wipe or with a warm washcloth, something like that, just so that you get any debris off of it. Because some animals can have a dirty poop chute that gets material on this area, and you don't want that. You don't want to collect dirty poop chute urine. You want to collect urine, clean urine. Then you get a clean, dry container, not something that you just ate the last bit of hummus out of and you sort of rinsed it. You want something clean and dry. And dry is important because you want the urine to look as concentrated as it really is. Ideally, you want to get the first morning urine, because in the morning, your animal has not had anything to drink all night. Usually. I mean, some of them, if if they're having a problem, they may be getting up to drink, but most animals don't drink much at all overnight. So it'll be maximally concentrated without you having to take the water away from them. And you don't really want to do that if you're not sure what's going on with your animal. And then you can refrigerate this urine up to 12 hours and before you take it to your vet to be analyzed.